Our first speaker today, appropriately, is a nurse from Maine Medical Center. She works in the emergency department, so chances are we will all meet her at some point while she's at work. Her name is Kirsten Lane.
Thank you.
Come right up front. Come right up
Good
front.
afternoon, everyone. It's so good to see you all out here today. My name is Kirsten Lane, and I'm a registered nurse at Maine Medical Center. And I'm a proud member of the Maine State Nurses Association.
Give her the bullhorn.
We're going to make a quick change. Thank you for that feedback. Can everybody hear this? Okay, so here's what I'm going to do. This. All right, go ahead. No, you can start over.
Good afternoon, everyone. So good to see you all out here today with us. My name is Kirsten Lane, and I'm a registered nurse at Maine Medical Center, a proud member of the Maine State Nurses Association and the National Nurses United, which is the largest union of registered nurses in the country. As a union nurse, I have long fought for Medicare for all, because we nurses know that healthcare is a human right. As nurses, we see the consequences of our broken, profit-driven healthcare system every day. Our hearts break for the patients who have suffered without care because of high costs or denial by insurance companies whose only interest is their bottom line. As we continue to fight for Medicare for all, we are standing up today to protect one of our country's most critical public health programs, Medicaid. Medicaid is fundamental to the survival of 72 million Americans, 50% of the country's population. Look around you, that's 1 in 5 people. But this administration is cruel. It is literally ready to steal billions from the poor to give to the rich, as they demand to cut $880 billion from Medicaid. And all that to pay for a tax cut for billionaires. This is a knife in the back of the people across the country, from the biggest cities to the quietest back roads. We know what these cuts would mean. Elderly and disabled people would be robbed of the support services they need to survive. Millions could lose their ability to get anything but emergency care. Without Medicaid, we know patients won't get the preventative care they need. Instead, they will wait until their diseases worsen before finally seeking emergency care, leading to serious illness and more unnecessary and preventable deaths. And the cuts will touch us all. As the number of uninsured people skyrockets, so would wait times at already crowded emergency rooms. Our existing healthcare systems would be incapacitated, much like we saw during COVID, or even worse. Medicaid represents nearly 20% of the spending on healthcare in the U.S. It provides critical funding for rural hospitals, public facilities, and safety net hospitals. Cuts to Medicaid would lead to more hospital closures and serious economic hardships for communities where healthcare is the main driver of the economy. We know Black and brown communities would disproportionately suffer the burden of these cuts and closures. We know the billionaire class is trying to silence us and degrade us and the vulnerable people who we stand for in this fight. But we are not going to stand by silently and let that happen. No! That's why we are here today, outside of the office of Senator Collins, who has the power to help stop these cruel cuts from taking place. We have brought a check that symbolizes what Congress is considering, taking money from the working class and giving it to billionaires. We're asking Senator Collins to help rip up this check and say no cuts to Medicaid.
No cuts to Medicaid! No cuts to Medicaid!
No cuts to Medicaid! No cuts to Medicaid! No cuts to Medicaid! No cuts to Medicaid!
We know the fight for justice is a practice and not a destination, and we are using our collective power to put that practice into action today. Working together and using the collective power of our unions, the workers, and the people is the only way to confront these assaults on our communities. I call on you all to join me in the fight against this attack on us all. Thank you for being here today, and thank you for standing with nurses and our communities to protect Medicaid.
Next, I'd like to introduce Todd Christian from the Democratic Socialists of America. Thank you, Todd, for being here.
Thanks, nurses. I want to start by saying that I have to give a big thank you to the Maine State Nurses Association and all the nurses and medical personnel who work in the state. My family has been personally touched by many of you, and you are the backbone of our state. My grandfather spent his last days in a dignified and caring Veterans Administration home in Norway. My father, my grandmother, both passed away at Maine Medical Center after receiving excellent care. My nephew just went through Maine Med for an emergency appendectomy. So I know what the nurses and the medical people in this state do for us, and I have to start by saying thank you very much. Now, why is Trump going after Medicaid? Is he just cruel?
Yes.
Is he mean-spirited?
Yes.
Is he a little nuts?
Yes.
So he may be doing it for all those reasons, but I think there's a method to his madness. See, back in the day after World War II, our ruling class could give us butter, they could take their profits, and they could supply the guns to run the world empire. After the 1970s, they shaved it back. They said, we're going to keep the guns, we're going to keep the profits, but instead of butter, you're going to get margarine now. Trump has decided, we're going to keep the guns, we're going to keep the profits, and you're going to get sawdust. The way they're going to get the money to keep the guns and the profits, the only place that pot of money is going to come from is the big so-called entitlements. And they're really not entitlements. They're rights.
Yes.
Yes.
They're not going to get hundreds of billions of dollars from the Department of Education because there's only $60 billion a year there. They're not going to get hundreds of billions of dollars from SNAP. They're not going to get hundreds of billions of dollars from school lunch programs, and they're certainly not going to get hundreds of billions of dollars by attacking trans kids in Cumberland. Nope. They're going to get hundreds of billions of dollars by getting their hands on Medicaid, Medicare, and Social Security. And anybody who doesn't believe they're coming for it has got to wake up. We have to build a coalition in this state and this country that says no cuts to Medicaid, no cuts to Medicare, no cuts to Social Security, and we have to bring the entire family of all of us who rely on that, from the healthcare providers to the patients to the students to the teachers to the workers. We need to build a giant coalition that says no. Susan Collins is not a passive bystander in this mess. She has been a facilitator of Trump, and she has to know that if she doesn't wake up on the right thing, she's not going to be our senator for very long. Thank you to the nurses. Let's go and see Senator Collins.
Hold on, let's hear it again for Todd Christian and DSA. Next, we have Dr. Julie Keller-Pease from MaineCare, a veteran fighter for healthcare for all in our state. Thank you for being here.
Thank you all for coming. As Todd said, my name's Julie Pease. I'm a psychiatrist. I practiced in Maine from 1987 to 2016. I've also worked in New Zealand, where I've experienced the benefits of universal health care. I've been an advocate for patients since 2010 through my work with MaineCare. First of all, I want to thank all of you for coming, and I specifically want to thank the nurses and organizers of this rally. As a patient and as a doctor, nurses have always had my back. Nurses put patients first. Nurses advocate for patient safety, for health, and for wellness. Today's rally is just one of the examples of your dedication to our well-being. So thank you.
Thank you, nurses!
And along with the Maine State Nurses Association, MaineCare is a statewide organization that has been advocating for universal health care since our founding 15 years ago. By universal health care, we mean everyone is covered. All means all, everybody in, nobody left out.
Everybody in, nobody out. Everybody in, nobody out. Everybody in, nobody out. Everybody in, nobody out.
People understand that our country needs Medicare for all. It's clear we need to finish the job and improve and expand Medicare to cover every person. making healthcare a human right in the United States. But this is why I'm here today. Maine is facing a healthcare crisis. Maine hospitals are already facing cuts in Medicaid payments. Thousands of Mainers are facing the loss of their MaineCare coverage. Thousands more Mainers, including many who have health insurance, are facing bankruptcy due to medical debt. 11 of Maine's hospitals, that's over 40% of Maine's hospitals, are at risk of closing. Cuts to Medicaid are affecting all Mainers, and further cuts will be devastating. Maine people will suffer, Maine people will die, and Maine's healthcare system will collapse. So, as the voice of the active supporters of MaineCare, and as a voice for all of Maine's patients, I have a simple message for Susan Collins. Do not defund Medicaid.
Do not defund Medicaid! Do not defund Medicaid! Do not defund Medicaid!
Senator Collins, if you vote to cut Medicaid, you will have Maine's blood on your hands.
Yes.
We need care, not cuts. And to the Maine State Nurses Association and the NNU, we at MaineCare have your back. To the people of Maine, we have your back. To Senator Collins, do the right thing. Reject the cuts to Medicaid. Fund health care, not wealth care. Thank you very much.
Dr. Keys, amazing. Thank you so much. Next week from the powerful kick-ass organization, the Southern Maine Working Center.
Going up to the tech presentation? Going up to the tech presentation? I wasn't going to, but I feel since I get the check. Well, they usually don't work in protest, but they can go to the office. Last time I did one of these, everybody went out. Yeah. Maybe just for steaming it and all the functions. Yeah, they can. What's that?
It's been a while since I've been here. Is it one straight back or is it to the side?
I think it's straight back and then the elevator and it's up on the upper floor.
I got a milk this is just on both sides, so yeah, I got this afternoon.
Yeah, it's
Shoot,
a live
a lot of
thing.
Right. They're like, what is this guy doing? He's working, man.
No, he does. He pulls it off.
Yeah.
Yeah, that's what I was gonna say. Sorry, I was on the
Eighth floor.
8th floor. Who wants to do 8 flights of stairs? We're fine.
This is totally fire code safe.
Yeah.
Yes.
Capacity.
We have plenty of health professionals here.
Yeah, that's true. Should anything go wrong. It's 8 floors. And it's thanks. She's 802.
Let's just wait here for everybody else to come up. Let's wait quietly so we don't get kicked out before everyone can get here.
It's a little surprising.
Did you drive down today?
Drive back afterwards.
Oh.
Sorry.
I was in DC a couple of weeks ago.
Oh, in March?
Yeah.
Yeah, it seemed like it was really fun.
That was really great.
And I was like, interesting. Should be.
Good, how are you? We are with we have some of our nurse members here.
I can see that.
We got more coming.
Right, okay. And I don't know, did this is sort of more than we sort of accommodate here
That's
at
okay.
a time.
Let's let everybody come up and then you can take in as many as you can.
We have
Well, actually, it's a building rule, not our personal rule.
We'll do it in shifts.
Let the cops come.
Well,
Yeah.
It's a big building, 8 floors.
Yeah, the secret place, the goons
I
front.
mean, the policy is 8 at a time, and we've actually got 6 in the waiting room.
That's okay.
So,
We'll get everybody here and then we'll go.
I understand. Okay, well,
Will I get by?
Yeah. I work here. I just want to get
Oh,
to my.
go ahead.
Thanks.
yeah, so we're well more than 8.
Few more than
No, I understand that you care deeply about the issue, and I'm happy to register your concerns. I think the question is how to go about doing that. And this is,
I suggest we just walk in. Call the cops.
We need to
Hold on,
deliver.
brother.
Bring it in.
Hold on.
8 people. Oh, no.
We're not gonna do
No.
it this way. We're not gonna do it this way.
Oh, that's the problem. We don't do it this way.
Let's see, do we have anybody else coming up?
Sorry.
Yes.
Yeah, we get another overpowered.
so, one way I could do this is I could give you forms to fill out, if that would be agreeable.
Folks can you take in?
Forms to fill out?
Well,
Is that what he said?
the policy is 8 at a time.
Actually talk to somebody.
And of course, this is many more than 8.
Yeah.
And at some point, my
Our
guess is the
country
building's
is
going to
turning
be.
fascist, led by dictatorial jackasses, and we're here trying to be nice. Oh, let's fill out forms. Let's take it to court. Yeah, that works. When are we going to realize that we're over the cliff? We're beyond testing the limits. Anybody remember Germany in the 30s?
Yeah, I bothered for.
Well, I don't care. No.
Does she even get our phone call?
Yeah, no,
we give her the notes from our phone calls?
your comments and we relay them.
Okay,
to
we'll just wait for the
TC
goon
on
squad to take
Yeah,
it.
we're her
Wait,
constituents.
Wait till they come to your job.
We're really hard on this.
record your
Yeah, I am too.
comments and we relay them to the senator and she reads them.
I'm having trouble getting either phone.
Well,
Go
I
ahead,
mean,
come on through.
we're 2.5 people in this office. We're fielding 2,000 to 4,000 comments a week.
Oh, can't do that.
No, you can't.
Yeah, you can kick people off of Medicaid, but you can't block the bathroom.
We're all here.
Did this last time. I'm happy to help.
When is Senator Collins' next town hall?
Yes.
You have to ask.
Yep, thank you. Okay.
She hasn't had one yet, has she?
So-
No town halls.
She's very accessible.
So I need 8 nurses to come forward. 8 nurses. 8 nurses.
Yeah, but the issue is still blocking this hallway.
We will take.
Line the
take care of
walls.
that.
We'll straighten out.
line the walls.
And 8 nurses.
Yeah.
Well, let me see if the first group has left, and then we can take. They have left. Well, I'll project it out.
By the way, Susan Collins was not at town hall yesterday in Gorham, so she is not accessible. We had over 500 people at that town hall.
Measure, she is amongst the most accessible.
She is not accessible. She has not done. She has not done a town hall for 20 years, over 20 years.
Tell her to show up.
Okay. So how many can you take in there?
We will take 8 at a time.
Okay.
And I think again, there's a building policy about the number of people who can be.
Right. You let us worry about that, and we'll worry about. We'll take care of that. We will get out of here as soon as we have 8 people in that
All right,
office.
let me see where we're doing.
8 nurses.
8 nurses.
All right, very good.
Thank you. Thank you very much.
Let me just get it. Yes. Thank you, folks.
She's got a roll ringing out the back right now.
Yes, we'd love to see that. We would love to see that.
She's a child.
You did. That's right.
Oh, no, you, but.
I will go in there. Yeah. Okay, once we have our people inside the office, there's gonna be 8 nurses, taking the check, delivering it. Then we're all gonna go downstairs, take care of our responsibility to clear out this hallway so nobody else gets too upset. And then we will do a couple chants, a couple more pictures, and then we'll go. Does that make sense? Does everybody sound good? That's good for everybody? All right. Thank you for being here. This is amazing.
Thank you for organizing.
You are welcome. Thank you, nurses. Thank you, community. Thank you, All Care. Thank you, Southern Maine Workers Center. Thank you, DSA. Who am I missing? Thank you, APWU. Thank you, Doris.
No, actually, I'm not inviting you in. Our policy is no recording without advance permission from the comms office. So I'm going to ask you to stay outside.
Yeah, no problem.
Thank you. And then if you've got 8 folks who are ready to come in,
Okay.
we'll take 8 folks.
Sorry, guys.
All right. Ready? Okay, let's go for it. 8 folks.
All right.
You ready, sir?
I am ready.
Very
for
good. Here we go.
8 of you.
Nurses in the check.
Love nurses. Go
Okay.
nurses. We love you, nurses.
Take care.
We love you.
We have a little check for Susan Collins.
Well, we won't be accepting your check. I'm sorry.
It's not real.
All right. So you want to bring the check? All right.
Yes.
8 of you in the check.
Okay, thank you.
Very good. 2, 3, 4, 5, 6, 7, 8.
Thank you very much.
Well, all right. Very good. Yep. It's a small one.
All right. They won't want to sit here.
It's you.
I have a live stream.